Now that we know what requirements are needed for language, how do we learn language? How do we go from birth, a clean slate, knowing nothing, to being able to communicate with people within a few years? First, what is the difference between language acquisition and language learning? For language acquisition, the process happens at a young age when the brain is ready to receive language input. This period of time is known as the critical period hypothesis, and linguists believe the language acquisition device is responsible for infants to easily receive language input. One of the critical points of language acquisition is that the process happens naturally and spontaneously. Unlike language learning, there is no structure processed. Infants are not sat down and explicitly taught the rules of the language. Instead, parents, adults, and other language masters will speak naturally around the infant, and they will, over time, pick up the language. Lastly, language acquisition has nothing to depend on. There is no first language for the infant to make connections to. Therefore, continuous language input is necessary for their language development. Language learning is the opposite of acquisition. It happens after a person has a first language and typically in a formal setting, such as a classroom. The rules of the language are explicitly taught and explained. The learner then has to practice and apply the knowledge to develop their language skills. There is typically a teacher or tutor who is in charge, structures the lessons, and is able to explain cultural and linguistic nuances to the student. Lastly, unlike language acquisition, the person already has a language and therefore they make connections between the first and second language. They also depend on their first language when learning their second. It also means if they do not understand a concept in their first language, they will not be able to understand it in their second. So what do we know about language acquisition? There are a few different theories. However, because of the age of infants and the limitations of technology, researchers have limited ways to be able to scan the human brain to watch the language acquisition process. The first theory proposes that all humans are born with linguistic knowledge. Then when the baby is born and is exposed to a language, the brain triggers itself to begin processing the input and using the innate knowledge of human languages. The second theory proposes that humans copy what they see and hear. That when they are born, their parents speak or sign, and they will take in that input and then replicate back to them. This is partially true because babies learn what they are exposed to, and the arbitrariness of language makes it impossible to naturally learn without input. At the same time, children make errors, adults often do not. If children are imitating adults, how are they making errors they have never heard or seen? Secondly, children produce new and novel sentences. Language is not every person copying and pasting sentences they heard. We are able to produce any sentence we think of. The next three theories are generally more accepted versus the last two. The third theory proposes that children work with what they know and go from there. Meaning, as they begin to experiment with language, they watch for feedback from language masters and adjust their language use. If they are receiving praise, they know they should continue doing that. Whereas, if they are perceiving they are being scolded, they may adjust their production. The fourth theory proposes the brain makes new neural connections based on exposure to the language. They begin to associate sounds with words, words with meanings, and their brain creates new neural pathways. The final theory proposes acquiring language through interaction with other people. As they interact with people, their exposure to the language increases. As their exposure increases, they are able to develop their language further. It is also theorized that these interactions feed their desire to communicate, thus increasing their level of exposure.